Welcome back to Morning at NTV. Now we're getting into a conversation that you might have seen some reports about when it comes to sexual reproduction, health and rights to information that many Ugandans have not been able to access during the COVID-19 pandemic, when we had also a lockdown announced in March. And what has resulted now, the easing of the lockdown has had people perhaps access some of the services, but more of the conversation needs to continue to happen. Now I'm joined by Miss Edith Akiro, a program analyst at within the United Nations Population Fund. Welcome to NTV.
Thank you very much.
And I'm also joined by Winnie Brenda Watara, who is the programs manager at Reach a Hand Uganda. You're welcome to Morning at NTV.
Thank you.
I would want to get into the details of this, but perhaps I'll let you talk about it. Brenda, Winnie, you do engage with the youth on a daily basis. What has it been like when it comes to access to sexual reproductive health information during this time within the country?
Thank you for the question. Access to sexual reproductive health services and information has been difficult even before the pandemic. It's just that the pandemic has exacerbated some of these issues because of the context within which we live, where sexual reproductive health issues are looked at as a taboo or are looked at as something that shouldn't concern the citizens, because the general rule is that young people should possibly not have sex at this time, even when they're having. And for us, it's quite entrenched. This whole norm is quite entrenched, and so the pandemic just exacerbated these issues because a lot of young people now even couldn't leave their homes to go to health centers to get these services. A lot of programming, even government programming, had gone towards fighting the pandemic, of course, because it was a new thing, and we didn't know how to approach it at that point. However, when we settled as organizations, but also as government of Uganda, we saw some effort being channeled towards improving the access of young people to SRHR, and with partners like the UNFPA and Irish Aid, this was made possible. For instance, when the COVID pandemic just hit, we had to think about creative ways through which we could get young people to access services under the circumstances. And as Reach a Hand, with the support of UNFPA, we came up with a USSD code, which is basically *284*15#, and it's accessible to all phones, feature phones as well, as well as smartphones. So we can't say it discriminates against a certain kind of young person who's in the rural areas. So when a young person could dial this USSD code, we would refer them to the nearest health facility that was offering sexual reproductive health, including on HIV/AIDS, family planning, and also COVID-19, if they just had any questions that they needed to have answered. And for us, that is what we did, just trying to use innovation to try and improve access to services for young people in the country.
How has this access been able, has it changed anything, Edith, when you take a look at the numbers now? When you look at the number of people that were coming in and the number of people that are now coming in, even during this time, has anything changed?
Okay, before I really get into the changes so far made during the COVID-19 period, I think I just want to paint a picture of really what we are talking about here. We are having 10 to 24-year-olds constituting almost 68% of Uganda's population. And their sexual reproductive health and rights becomes even more crucial in times like this, when we are hit by a pandemic, when mitigation measures to contain the pandemic already curtail and make it even difficult for the already difficult situation. So we are looking at a population that literally needs to be guided, a population that literally needs to be, services to be accessible and services to be near. So when we're hit by the pandemic, we saw the lockdown. First, very few services were clustered as essential. So it became even more difficult for these young people to go to a health facility because they relied on private transport, they relied on peer influence, they relied on communities to actually access some of these services. But then the partnership with organizations such as Reach a Hand, it became easy to say, how do we really become more innovative? And as UNFPA, we believe in innovations. So coming up with innovations to actually increase access to services became paramount in this situation. And I've seen a lot of online campaigns. I've seen a lot of media campaigns. I've seen a lot of online attempts to increase services. And over time, we are seeing actually young people coming up, most especially conversations on social media, are changing. You're seeing young people saying, we want more of this. And just if you remember, about 2 weeks ago, UNFPA also had a partnership with Safe Border, where we are distributing over 1 million condoms in Kampala and Wakiso. But more to that, actually, you're also seeing that it went on to actually register an online personal health or reproductive health commodities. So such innovations are taking services further, and we are seeing more and more of this demand emerging. But then we are also saying, at this point, more needs to be done, because remember, this is only like a tip of the iceberg, but the actual consequences of this lockdown, of the mitigation measures to COVID, are actually going to happen even much later.
What are those consequences that we might see much later on?
Media has already told us, has already been profiling some of the cases. We are seeing, like a spike in teenage pregnancy. We are seeing a spike in, kind of like defilement cases. We are seeing low reporting of even criminal cases. And this is not because it's not happening, but because how to actually undertake that reporting has become a challenge. The measures, the reporting mechanisms have become curtailed. Think of a situation where you're all locked up in a family and you're a teenager. You have been defiled, probably by your very close relative. Whose phone are you going to use to call out there to actually make this alarm to say, I have been defiled? Many of these young people relied on youth-friendly services that are located in health facilities. But here was a situation you're locked up. And even getting to a health facility became difficult. But thanks to actually having these very good partnerships with very innovative, very, very dynamic organizations such as Richer Hands, such as Safe Border, we had to think through the box and say innovation is the way to go. Online is the way to go. And we are seeing people accessing services. We are seeing people having different sorts of conversations and asking more and more and more. Like in Kampala alone, when you look at the stories that are coming through the Safe Border app on sexual reproductive health services, somebody says, I'm so happy now that I can actually access these services more privately, but online, which I could not earlier on, access. So these are the small changes we are seeing, but yet very deep and very meaningful contributions that we are making in terms of actually making young people access these services.
Now, when we speak about the young people, and I'll ask this to you, Winnie and Edith, when we take a look at the fact that you said online, we're seeing more attempts, people are trying to reach out, innovation is coming up, but where do we put the parents of these children? Where do we put the society that thinks I shouldn't be telling a 15-year-old about contraceptives? I shouldn't be having a conversation about condoms and saying, if at all you're going to do this, you need to use this. Where do we put this society where at some point some are willing to go ahead and embrace it, but we have others who are still lagging behind on their beliefs about this? I'll start with you, Winnie.
So what I would say is that there is an urgent need for social behavior change among parents and the gatekeepers in society, including religious leaders. Late last year, we had a research on how parents perceive sexual reproductive health and how they could help young people to continue trying to access these services. And the unfortunate bit is that parents thought that their children were spoiled. And while our parents are burying their heads in the sand, it's not what's happening. The reality is that young people are engaging in sexual activities, and some of them as young as 14, because of things like early marriages, are facing some of these issues. So for us, what we would tell the parents currently is that we need to change. We are only postponing the problem right now because the young people are within the confines of your home. They possibly don't have, due to the pandemic, can't go out. But when they're exposed in social settings like in schools, in communities, when they go to the markets, there are people who actually approach these young people and entice them or even violate them. But how then do we protect these young people? Definitely through information. Information does not lead to early sexual debut. There is actually concrete research on this. It actually delays it because you have put all the options for young people on the table. You're like, if you do this at this age, these are the consequences that you may face. And because your future will definitely be affected, you shouldn't do this. Young people listen. Young people are not that big-headed, and they will definitely heed to the advice of their parents. However, if parents continue hiding this information from them, there are alternative sources. The internet has now penetrated all parts of this country. So young people will look for alternatives to get this information, yet they can get a guided they can have a guided conversation with people like peer educators or youth champions who are spread across the country with this. UNFPA has youth champions, Richer Hand has youth champions, very many young people organizations have youth champions spread across this country. And these young people are trained to give this information. You as a parent, definitely it's your prerogative to give this information. You have failed because of God knows what. Maybe it's your culture, you waited for the singers, but now singers are being phased out. How do you help these young people access another young people who have this information? There are youth corners at very many health facilities in this country. How do young people go to this on a youth day and get the required information? How do they get this? How do they get information on the alternatives of contraception that they may need? This is in the case of a young mother who wants to delay her next pregnancy, even though she's married, but she definitely wants to. How do you give her that these are the options you have? If you want to delay for 3 months, this is the method you could use. If you want to delay for 5 years, this is the method you can use. And this information is all over the country. Of course, we can't talk about it independent of stockouts of some family planning commodities, and that's where the government of Uganda has to come out and reinforce what it's already doing. Partners like UNFPA are supporting the government through providing commodities, through helping with the distribution. But how do the people providing the commodities, Richer Hand, who's doing social behavior change, and the government of Uganda strengthen the efforts that they have to continue improving the space for young people's sexual reproductive health rights?
Now, as we get your thoughts on it, I just want to ask you this as well. We have applications to help the youth access this. Do we have applications to also help the parents in one way or another? Are we having those conversations with the parents?
Thank you very much. Yeah, I know everything is going virtual. And as Brenda said, right now, risk communication becomes even more paramount, not just for COVID-19, but against child marriage, teenage pregnancies, access to contraception, even just to delay repeat pregnancy and protect oneself from HIV and AIDS and other sexually transmitted infections. This is more crucial now than ever. So what is happening is that from UNFPA's side, and also working with the Ministry of Gender and the Interreligious Council, we are trying to utilize the structure of the church to reach out to the communities that they represent, that they minister to. And I'm happy to tell you that within the period of COVID-19, the Interreligious Council actually adapted a sexual reproductive health and rights communication religious guide to support them channel this information. And if you always see broadcast here the Archbishop of Uganda preaching against teenage pregnancy, preaching against domestic violence, preaching against early marriages, it is based on that translated sexual reproductive health and guide. So we are trying to take, again, virtual conversations to the church around sexual reproductive health and rights, taking virtual conversations to the cultural institutions to support actually, communicate around all the risks that are associated with the lockdowns, but also the practices that are actually been happening. But only that we are seeing that the lockdown is only making them more pronounced.
It is
because families are more confined. Structures, society is grappling with different challenges. So we are only seeing that they are more pronounced now. But this is already what has been happening. So they're only coming forward to light because we are now seeing that the family structure, in a way, is changing in terms of coping with the day-to-day needs amidst all the measures of lockdown.
Do you see any changes from these campaigns? From the time, because for everyone who's watching, they have watched them, but are you following up to say what has changed? Are we seeing that perhaps the magnifying glass is actually doing something here, and people are, maybe mothers are saying something, maybe the children are coming out to say something in the family is changing?
Okay, anecdotal evidence seems to say actually media has done very well, because all over the country, whether it is in radio stations, whether it is in local radio stations up country, these conversations are ongoing. And the media has done its job within the circumstances to try to reach out and say, on some of the negative, impacts of the consequences of lockdown on all aspects of society. So it is very common to hear all these conversations happening. And for us that, who sit in different meetings, you're hearing voices coming through civil society organizations. You're hearing reports coming through various representatives of various organizations from different districts. And then we're also seeing a very rich reporting and a lot of highlighting of some of these issues. So it's, for me, I think that alone shows you that the magnifying glass has done quite a good job in terms of, putting to the public these issues, because we have not, or the media has not only focused on communicating around COVID-19 and how to prevent oneself from, getting infected from COVID-19, but again, what are the other challenges that have come with the lockdown measures? And we have seen a lot of sexual reproductive health issues come out, a lot of profile on teenage pregnancies, a lot of profile on child marriages, a lot of profile on incest. For instance, I think a couple of weeks ago I saw a media clip that was being contained around a brother who had impregnated his two sisters. And then we have seen a lot of profile around maternal health issues, for instance. We have seen a lot of profile around domestic violence that have resulted into murder. So all these have also got into the actual government discussions. And to tell you, this has also influenced, like for instance, getting sexual reproductive health into the continuity of essential services guidelines. There is a whole section that outlines clearly how adolescents should be treated in this situation, how young people should be treated, how continuity for sexual reproductive health and services for young people should be continued along the essential service health chain.
Now, talking about those government discussions, one thing we have learned is that all the effects that we're seeing, things that have come to the top when it comes to this COVID-19 pandemic, are things we might have to deal with for a long time to come, and we need to change a number of things there. Now, when it comes to government discussions, what should the government going forward when it comes to government policy, when it comes to discussions in schools? Because when it comes to the Ministry of Education, these conversations are something that all of a sudden it has started, the conversation stops. Going forward, what do we need to see the government do? I'll start with you, Winnie.
Government has done a tremendous job through the ministries of gender, education and health to try and improve access to sexual reproductive health. There is a policy like the National School Health Policy. While young people are now out of school, it's important that by the time they get back into the school environment, this school health policy is rolling, so that young people are protected against certain issues and also can openly speak up about sexual reproductive health issues. The National Sexuality Education Framework, which has received a lot of backlash, and government should make it a priority to speak to the gatekeepers, because a lot of these policies have stalled, not because of the lack of government effort, but because there are groups of people in society who have not yet fully grasped the potential benefits of these policies, who are against it. And it's upon government and civil society organizations to sit these groups of people down and tell them this is the reality on ground. And there's evidence to this effect. There's evidence that can show the trends of unwanted pregnancy or early and unintended pregnancy. There are trends to show that HIV prevalence in Uganda, and very many issues, including maternal mortality. We don't want to backslide to where we were before. And so for us, government should make it a priority to discuss with the gatekeepers of society, from culture institutions to religious leaders, to just make them understand that these policies actually do no harm. There is a perception that when young people are given sexual reproductive health information, what these policies are intending to achieve, there is early sexual debut. But like I said before, there is also evidence that shows this delays sexual reproductive health issues. But if we continue burying our heads in the sand like we're doing right now, and demonizing people who are trying to emancipate young people, who are trying to guide young people to make decisions that will help them improve their lives and also their livelihoods, because economics and sexual reproductive health are intertwined. We've all gone through the system where where young people who have children at a certain age are more likely to face certain difficulties as they go ahead in their lives. And for us, this is what we want them to do. Government is doing a tremendous job. Policies are in place. How do we effectively spread this information? How do we effectively implement the policies that exist? The Ministry of Gender through UNFPA is also working on an out-of-school policy for young people, because while we have concentrated on people in schools, young people out of schools are neglected, and yet you see a trend in education that there are very many dropouts along the way. So we are really eager to see this policy also come to fruition. We are eager to see it support young people who are out of the school system. But for us as Reach a Hand and our partners, we take the stand that the national school health policies should be passed. We take the stand that the national sexuality education framework should be implemented in its entirety. And also, we call upon the support of the government of Uganda, religious leaders, and young people everywhere to stand up and say, this is our right, and we deserve to be in control of the decisions that we make.
Okay, and you, Edith? I see you nodding in agreement.
Yeah. You see, we are not in short of policies in this country. But what we are short of is actually the implementation. And from my perspective is that I think the COVID-19 pandemic gives us another chance to actually rethink and say, how do we implement the beautiful policies that we have, the beautiful standards that we have and guidelines that we have. So I think moving forward is that after this, as I said earlier on, we are going to see even yet the bigger sense of really the impact of the lockdown measures, of the measures to contain COVID on the population of this country, especially on the health of young people, on the health of women, but also on the general landscape around gender-based violence. So as we even go to, as we start the conversations around, for instance, the school reopening, we would like to see a situation where the Ministry of Education, for instance, in its conversation is not only thinking about reopening, but what are they going to be doing for the teenagers who have got pregnant in this period to support them for school, probably for re-entry. So we would want to see that kind of progressive conversation. And then too, Brenda talked about the sexual education framework. The guidelines have already been developed. But if you look at it, is that it has been a very slow pace. And yet, this is a framework. This is supposed to empower not just the girls, empower the teachers, but also empower the parents in themselves. It's not about teaching sex. It's about sexuality of a young person. Like, for instance, how to manage your own menstrual health. And even before COVID, there was a lot of linkage between menstrual health management in school and the school dropout. So we want to see that kind of progressive conversation. And then around the girl environment, how are the gatekeepers prepared to take in some of these consequences and plan for some of these consequences? For instance, the family environment in a way has been disoriented. So we want to see a situation where families are actually supported to support this girl. Livelihoods have been affected. We've had again and again how young people are getting into sex work, how young people are getting into child marriage and cohabitation because of the pressures within the family.
Now, Edith, that's where just shortly as we wrap this up, I would want you to talk about empowering the youth to know that sometimes you don't have to go into maybe sex trade to get money. Families that perhaps believe that if my child can be sold off as a bride, we would have money. There was a story about earlier on where within the lockdown where a foreigner was given a 15-year-old girl and he simply gave the family a house. Such situations, empowering, because we could have all the sexual reproduction awareness and health coming into conversation, but empowering our community to know that sex is not the answer when it comes to economy and survival.
Yeah. So this is where we go back to that very good saying, old saying, it takes a community to raise a child. And in this, you find that for a girl to be able to make such decisions, it takes a lot of actors to be able to empower. First of all, we begin with the family itself, the parents. How are we empowering the parents? How are we empowering the parents to undertake their parenting role? We have the parenting guidelines at the Ministry of Health, at the Ministry of Gender. But again, we go back to the same thing, implementation of the parenting guidelines. Okay. So now, if the family unit itself has lost the ability to parent, and in cases where we have also had the parents themselves sometimes actually procure defilement, as you see, a foreigner is given a child and in exchange for a house. That is the role of a parent. So we need to educate the parents, and we need to enforce the laws. We have the law in this country that says a child should not be getting married below the age of 18. But how many oftentimes within our justice system has this come to be implemented?
Yeah.
And then when we come to education, how much of our engagement from not just the Ministry of Education, but the gatekeeper of a child and communities. Remember that there used to be a time when literally education officers had to come one village from the next looking for children who are out of school. But that is no longer happening. Community development officers, the community workers and the parasocial workers used to do all these sorts of things, but all that is not happening.
Yeah.
So we need to go back to some of those basics to empower the family, to empower the community, to be able to raise up a child holistically. And also the duty bearers, and this is our call now, that as we reopen schools, as we go back to the new normal, what are we going to do that is so different to ensure that this girl who has got pregnant at this time goes back to school?
Well, we're going to take a short break and we'll be getting into that new normal, because moving forward, what are we going to do different? And we'll be bringing in Richard Hand once again to tell us what could have changed with the way you're now doing things when it comes to sexual reproduction awareness within the country. We're going to take a short break, but we'll be coming right back.
You're watching Morning at NTV.
Well, we're still taking a look at the sexual reproductive health and rights information and services during this COVID-19 pandemic, and we now go into a conversation of what happens after this, when eventually we go back to what will be our new normal and not what we used to know. What is it going to look like? And we had a conversation off air about how some children won't actually return to school where they once were, because if they have a teenage pregnancy, you find that some families will choose to maybe move the child to another school or send them off to another community because they don't want to have those conversations. So we'll start with you, Brenda. What will it look like?
What would it look like? And I'm going to give what the evidence shows in the interim, like anecdotal evidence, because definitely there is need to have a comprehensive look at the consequences, sexual reproductive health rights consequences due to the pandemic. What would it look like going forward? I guess for us, I will speak for organizations like Richard Hand. We just have to reinforce what we have already been doing. For the child, we can only do so much, but within our prerogative as Richard Hand, whose mandate is to provide sexual reproductive health information to lead to SBCC, which is social behavior change, we have to reinforce our efforts in communities, because while young people, we used to reach young people mostly within the confines of schools, now they're everywhere. We have to empower our youth champions and our peer educators to go to the different communities to provide this information, but not only provide this information, if they see something suspicious in the community, they're encouraged to report to different authorities. For instance, we have partners who have a GBV helpline, and they can seek legal redress from that GBV helpline. And honestly, we wish we could do more from the onset. However, sometimes within the family setting, foreign people are not allowed to penetrate that nucleus and provide this information. So most of the time, it's basically firefighting at the end. But what we are doing right now is providing this information in different languages. We have commissioned several radio missions on different stations in the different districts, just to give people the information they require, but also the referral pathways that they can pursue if they get any of these issues. We also talked about the USSD code that was developed. Easy. Feature phones, you don't have to have a smartphone and say, I'm going to get this information. Even if you have a feature phone, we normally call them kabiriti. You can just dial this number and get the specifics that you need on sexual reproductive health rights, family planning, gender-based violence, but even COVID-19. And even when you want a product that you want to use, Safe Border is there. We just have to discuss how young people are empowered to know what they want, and that's what Reach a Hand is doing with the support of partners like UNFPA and Irish Aid. For us, it's information. There can't be too much information out there. Give the young people the information they require. It's upon them to discern what they will take and what they won't take. But as long as we have done our part as Reach a Hand Uganda and as partners in this fight to improve the sexual reproductive health rights, yes.
Okay, and to you, Edith?
You see, Rita, moving forward, I think first of all the country, all actors need to get to the level where we are all appreciating the consequences first. Some of these are very sensitive discussions because they border around the sexuality of a young person. So I think we need to reach that point as all actors where we first all recognize that there is a problem. Teenage pregnancy, child marriage, domestic violence leading to murder is simply not acceptable. So once we all reach a point where we are all agreeing to that same, to that same point of view, then we can actually start saying we can now harmoniously go. Because if you realize the consequences, as I said, are going to be much graver, even after COVID. So I'm just going to say, first of all, on just the aspect of reproductive health commodities, we need to see a situation where we are maintaining that supply chain so that we are eliminating any chances of stockouts. And from UNFPA's perspective, we've tried to do that. Even under the current lockdown, we've tried to maintain the supply chain for reproductive health commodities. And we have tried to make sure that these are delivered to the last mile. And then we have also tried to see that how do we actually give fuel. We have had a partnership with Total where we are providing fuel to ensure that actually health workers reach the health facility to serve the young person. And if a young person or even a woman requires a service, she can get that service through a referral system that is functional. So some of those things need to be maintained if we're going to be fulfilling the sexual reproductive health and rights of women and girls in this country. And then two, we need to intensify this behavior change. We need to shift the social and gender norms that are already holding on to society, but are only being aided to come forward now because of the pandemic. So beginning with the family unit and beginning with the parenting, going to the stakeholders around the girl and the family. Can we go back to the basics and just be accountable and responsible for this person?
Okay.
Then come to the duty bearers. If a young person went to the health facility, is it responsive enough to provide the service? We want to see from the gate of the environment where this person goes for a service, the environment is receptive. The health worker is trained to give this service, and there are commodities in the health facility. Then we go to education. We talked about how are we going to handle girls who have already got pregnant because of the lockdown measures. Are they willing to open this conversation to say they can come back to school without stigmatization? We want to see practical guidance around that. We want to see practical, information getting to the parents around that. And then, of course, we cannot underestimate that this is an era of innovation. And we just cannot do business as usual again. We just have to see, for instance, internet connectivity in this country, you know how limited it is. Even ownership of mobile phones. So all these sorts of things, we need to be thinking about them clearly as actors, clearly as government, and put some of the priority in here, knowing that the 10 to 24-year-olds, which make the 68% of this country, is where the future lies. And if they are not properly educated, if they are not properly skilled, we are not going to get a country that is able to industrialize as we are anticipating, even our NDP3. So unless we do something about this age group, address their needs, that if this child is born, has a good family to come out from, and then gets into an education system that gives the person appropriate education, has the ability to maintain herself or himself, then at the same time has the ability to make the choices, and those choices are present to that young person, then we will be able to say we are totally seizing our ambition to industrialize this country.
As I take it from our conversation this morning, when it comes to sexual reproductive health and rights information and services within the country, we all have a role to play. We all have a role to play, and we should not be running away from this conversation, but actually taking part in it and making sure we can be able to help the future generation. Now we're going to be getting a look into your birthdays, the 22nd of June, in just a bit, but thank you so much for joining us this morning. Edith Akiro, thank you, your program analyst at the UNFPA, and we also had Miss Winnie Brenda Wetara, who is the programs manager at Reach a Hand Uganda. Thank you very much.
Thank you very much for having us.
Well, let's take a look at your birthdays now. A number of you are celebrating, but let's just take a short break and come right into them. Just play that back.
Thank you very much.
Well, now taking a look at your birthdays, the 22nd of June 2020. For some of you, you might be turning about 18, you might be turning 20, 22. Now taking a look at just a few of you who are able to share with us. We have Samuel Bishop Kibedi. He is a 15-year-old today, and we wish you a very happy birthday. We also have, this is from Mr. Frederick and Mr. and Mrs. Kibedi. Happy birthday to you. We hope that this year we will smile, you may be able to enjoy and have a number of people sing for you. I know it will be a scientific birthday, but all the same we still celebrate you. We have Walusaga Brian. It's also your birthday today, and we wish you a happy birthday. Now we won't be able to get into all those who have been able to send in their birthday messages, but we wish you all a happy birthday if it is your day, and in whatever way you can celebrate someone. Send them a message, sing for them, do it the way you know how to. But we hope that this year may God's face shine upon you. We also have, that's another birthday boy, but we also have, it's Gaetano Kagwa's birthday. We wish him a very happy birthday too. From us to you, we say happy new week, and may this new week bring some joy into you. Monday is not always a bad day, by the way. It could be a good day for you. So may it be a good one, and may the new week come with some good news. Have a good day, and we'll be getting into Mwasize Mutia later on with Farida Nakaziwe. From me to you, good day.